So good afternoon, learners. So today we'll be discussing about study section 11, which is immunity. So what do we understand by immunity? Immunity is just the body's ability to fight infection, the ability of our body to resist infection. You know, most of the time, we used to say that, okay, our patient has low immunity. When a patient has low immunity, what will happen? That patient will be susceptible to infection. So the immunity is what helps the body to fight any form of invading pathogenic microorganism. Now, let's briefly discuss about types of immunity. We have the adaptive immunity, we have innate. Those are the two types we have. Innate is actually the one that we are born with. So in innate immunity, that's the one we are born with, the natural one. Then the adaptive can also be called acquired. So that one is not innate. Then the adaptive cannot be divided into natural and the artificial. So when we are talking about natural, that means it can also be passive or active. Then the artificial can be passive and it can be active. So some, for example, now the passive immunity for natural, take for instance when there is transfer of antibodies from the mother to the fetus during intrauterine life, that's example of passive. Then for active, when you develop the infection yourself, maybe you have chicken pox and you develop the antibodies, that one is more like active. You're the one that developed the antibodies yourself. Then now let's go to artificial. Under artificial we have passive, we have active. So for passive now, when we are talking about antibody transfer, like all these giving of all these immunoglobulin, when you are giving all this short injection of gamma immunoglobulin, then for active, when you receive immunization. So that's just the summary of immunity. Now, components of immune system, we have the bone marrow. What are actually the things that makes up the immune system that helps us to fight infection? We have the bone marrow, the thymus, the spleen, and then the lymph node. So you can read in details. Then cells of immune system, we have the B cells, the T cells, the natural killer cells, macrophages, and dendritic cells. They all have their various functions. So they have their various functions, but they are cells of the immune system. So let's take note of their name. Say for instance, now the natural killer cells are the ones that kill tumors. They kill directly. They kill tumors such as melanomas, lymphomas, and virus infected cells. Now we have spoken about innate immunity. Like I said, they are the immunity that we are born with. So these are the immunity that we are born with. Now let's talk about non-cellular defenses. We have differences in susceptibility to certain pathogens. These are there are two aspects. We have the species resistance and individual resistance. We have the anatomical defense. All these are non-cellular defenses. So the anatomical defense, like take for instance our skin, our mucous membrane. We have mucous membrane in our mouth, in our nose. All these are anatomical defense. They prevent the entry of microorganisms into our body. They serve as a barrier. They serve as a barrier. Like take for instance, if there is a break in the skin now, definitely it's a source of infection. It's a medium for infection to get into the body. Now we have tissue bactericides, including complements, which is considered as part of innate immunity because of its role. So that definitely in innate immunity, you can have cellular and non-cellular. So we have microbial antagonism. This refers to protection of the surfaces afforded by an intact normal flora in a healthy animal. Now, cellular defenses, we have inflammation is necessary for proper functioning of host defense. Say, for instance, when there is an infection process going on, definitely there will be inflammation. What are the signs of inflammation? We have swelling, redness, heat, and pain. That's a sign that infection is going on in the body. There will be fever. Patient will be having temperature, the patient will be having pyrexia, hyperpyrexia. Then cellular defenses, we have the phagocytic cells, we have the the inflammatory response previously described leads to recruitment of phagocytes to the site of inflammation. Phagocytes are a class of cells that are capable of ingestion and destruction of microorganisms infiltrating the body. We have the neutrophils and we have the macrophages. Neutrophils are always the first to accumulate when there is invasion of microorganisms. It is the neutrophils that first of all accumulate around that invader and initiate phagocytic process. Then for macrophages, they later migrate to the tissue side. So they are slower than neutrophils actually. So let's take note of these differences between neutrophils and macrophages. What are the stages of cellular defense? We have the first stage is delivery. Immediately there is an infection process going on. Immediately there is invasion of body with microorganisms. The first thing you see is that there will be delivery of phagocytic cells. They will all migrate to the site of infection because they want to go and fight. Then the second stage is that there is phagocytic adherence. They will adhere to the target. And what is this target? The target is microorganism. Then the next thing that will going to happen is that there will be injection and engulfment of this particular microorganism. And the phagolysosome formation will also take place. Then intracellular killing, they will succeed in killing the bacteria. They will digest it. So that's the process. So this diagram is just to guide you through these stages. We also have specific immunity. Specific immunity is also under innate immunity. It's just a complement to the function of phagocytes and other elements of the innate immune system. So let's read up. Now I've explained about active and passive immunity in the diagram. So that diagram will actually help to summarize. So thank you for listening. Thank you. Bye.